Ministry of Jobs, Tourism and Skills Training funded MOSAIC to develop and run the Care Aide Training for Employment CATE program. CATE provides skills development, practice placements, and employment support for internationally trained healthcare professionals to enter the Canadian workforce as certified healthcare assistants.
Probably one of the biggest challenges is health human resources, just actually the supply of people who are available to work as a healthcare assistant. With an rapidly aging population, we're in real need of getting people to be excited about working in seniors care. Going forward over the next decade, we're going to be looking at a growth in the total number of workers that we need, anywhere between 2 to 2.5% annual growth, which is significant when you think of how many people we have working in the sector, how many new people we're going to have. The provincial government actually just announced an additional $500 million is going to be invested into seniors care in the next 4 years alone. And what does that mean? That is translating into 1,500 new positions that we have to hire in the next 4 years. And that doesn't even account for the fact that people will be retiring. So we have to hire for the people who are retiring in the next 4 years.
CATE specifically identifies care aides with different ethnic or geographical backgrounds. So they bring a good talent pool of languages to the Lower Mainland community. So that's one in terms of what CATE does. The other benefit is that we have a huge population of immigrants who are qualified and experienced elsewhere but are not able to work in BC. Them being certified locally suddenly opens up their world and they can be a good contributor in the Lower Mainland.
I'm a nurse in the Philippines and work there as a registered nurse. My husband and me cannot find a job according to our professions. Financially, during that time, it's really difficult for us because we're just spending the money that we brought, but it's not that enough because we're four. So it's really a difficult times for us.
I'm a physiotherapist from the Philippines, and I work mainly in Middle East, in Saudi Arabia and Bahrain for 16 years. I was unable to meet the language requirement for physiotherapy, and I have to take an exam that is written and practicals, so it will take time, effort, and money as well.
We also find that our candidates who do apply for the healthcare assistant programs are new immigrants and at points have difficulties with the tuition. So coming above, the student loan comes into play, but sometimes the new immigrants are having difficulties with all of a sudden coming to a new country and being in debt.
CATE will help you unload some of the problems that you will be encountering as new immigrant.
I got a free education. CATE helped me in reaching my goal, which is to become confident in what I will do as a healthcare worker. I gained certificates like WMIS, First Aid, Food Safe, and also Violence Prevention. I will definitely recommend the CATE program to my friends and my family.
Because of CATE, we're able to have some few more contacts directly with the agencies. Our facilitator is helping us a lot in knowing them, not just by name, but personally we're able to meet them. Because you have this BC Care Aide registry, you will be able to have more higher salary.
I really think that what MOSAIC has done with this CATE program helps everybody. I mean, helps the new people with their new lives in Canada. It helps the community because of the aging community and the shortage of HCA workers. And today, as we know, all of our students in our current programs are being employed.
Any kind of training program or bridging program to get them from their current status into the healthcare sector is incredibly important, and I'm really looking forward to working with MOSAIC and with provincial and federal governments to look at finding opportunities to expand that.
CATE training for employment program is a successful model to train international healthcare providers to be able to work in a Canadian workforce. We're very proud that over 80% of our first cohort graduated with honors and are all completing their placement successfully.